నమస్తే. మై నేమ్ ఈస్ డాక్టర్ విజయ భవాని. నేను విమెన్స్ మెంటల్ హెల్త్ మీద పీహెచ్‌డీ చేశాను. ఇట్ ఈస్ మై జర్నీ దట్ స్టార్టెడ్ ఫ్రమ్ ఆఫ్టర్ మై ఇంటర్మీడియేట్ ఐ వాంటెడ్ టు డూ మై బీకామ్. I went and paid my fees in the college. Then my friend suggested that let's try out something different. And then we opted for a course called Social Work, Psychology, Industrial Relations, and Personal Management. So parents and convince చేయటం, I'm talking about 23 years back, it was very difficult for me to convince my parents saying that I want to do something like this. ఆ కాలంలో ఓన్లీ రొటీన్ BA, BCom, BSc, this was something what people knew, maximum engineering and doctor. But I wanted to do something different. So I said industrial relations, personal management అంటే labor officer, welfare officer ఇవన్నీ కావచ్చు. So I'll join that and I took up the course. But in the 3 years of my graduation, I realized that my passion is more towards social work. So after that, I did my PG in social work and also my PhD in social work with ICSSR fellowship. So in my social work, I had opportunity to work with different categories of people. I worked with the leprosy affected people. I worked with the mentally retarded children. I worked in prison. I worked in hospital for mental care. Above all, what I felt was women, especially in hospital for mental care, are somebody who needs lot of support, needs lot of compassion, and something should be done for them. Then my PhD, that's the reason why I took up women's mental health. నేను కమ్యూనిటీలో స్టడీ చేశాను, ఫిషర్ ఫోక్ కమ్యూనిటీలో స్టడీ చేశాను. అండ్ ఐ ఫౌండ్ అవుట్ దట్ of every 100 women, 53 women are at the verge of breaking down sometime to some sort of mental illness. That is the stress level that women carry out. So I thought, let's work on the root cause of women. And I started working with different national and international organizations on women issues. And especially women issues, there's so many things. The single women, there are domestic violence, there is, widowed women, there are so many other problems that women face. But in my career, I have worked mostly with two types of women: women who have been trafficked for sexual exploitation and women who are into sex work. I have worked with them very intensively, and I should say that God has given me this opportunity to rescue 472 girls in my life from human trafficking. And we could, with the support of different donor agencies, provide rescue rehabilitation services to these girls and women. When I say women, they age from 11 years um, to 40 years that we have rescued, and we provide rehabilitation, repatriation services for this woman. Then I thought we need to work exclusively on women, on certain women. Why are they trafficking? Why are they getting trafficking? Well, the reasons ain't they. We should work on poverty reduction. And we started working on poverty reduction. And then when I met single women and when I met many other types of women, I found out that there are so many sex workers in the community who don't want to be called as sex workers, but they are into this profession because they don't have any other option. Suppose మేస్త్రి పనికి వెళ్తారు, లేకపోతే ఏదైనా పనులకు వెళ్తారు, ఇల్లు కట్టడానికి పనులకు వెళ్తారు. బట్ ఇల్లు కట్టడానికి వెళ్ళే వాళ్ళు ఇల్లు కట్టడమే కాకుండా దే ఆర్ బీయింగ్ ఎక్స్‌ప్లాయిటెడ్ బై దేర్ మేస్త్రీస్, బై దేర్ మేనేజ్మెంట్ అండ్ ఆల్ దట్. సో వాట్ దే ఫీల్ ఇస్, ఎలాగో ఎక్స్‌ప్లాయిటేషన్ జరుగుతున్నప్పుడు నేను రోజంతా కష్టపడేది ఎందుకు, నేను ఇలాగే దిస్ ఇస్ ఇనఫ్ ఫర్ మీ టు ఫీడ్ మై చిల్డ్రన్ అనే అండర్‌స్టాండింగ్ వాళ్ళు వచ్చేస్తారు. సో దెన్ with different donor agencies, with different organizations that I worked, I could convince one big donor to work with women in sex work and providing alternate livelihoods to them so that we can reduce sex work. And lucky enough, I could convince the donor by showing them the ground reality. And I myself was able to identify 19,000 women across 5 states of India: UP, Bihar, Maharashtra, AP, and Telangana. 19,000 women in sex work. We identified them and we provided alternate livelihood to them. And when we provided alternate livelihood, we provided in such a way that we did market scan, we did complete understanding about their employability skills, about the skills they have, వాళ్ళ feasibility ఏముంది, what are the raw material availability, viability, feasibility అన్నీ చూసుకొని we completely did a market scan and then we put them into alternate livelihoods. And I'm very happy to share that 88% of women uh, retained their livelihoods. And even today, women call up and tell them, my son has graduated, my daughter has graduated. There is one woman who called up to say, my son joined as SI in police department. Another lady said, my daughter has cleared her group 1 exams. This gives me a lot of happiness and, one contentment that as social worker, what we actually aim, to help people to help themselves, we are able to do that. So because I've professionally studied social work and did everything professionally, so this is how my journey began. So I was also looking at my profile. US Embassy also recognized my efforts in the field of women and their issues. So I was sent to US under International Visitors Leadership Program on gender violence program. I visited different organizations. I've got understanding about how India and how US are collaborating to fight against gender violence. How is it there? How is it here? So e-exposure has given me a lot of exposure I have got through my profession. చాలా మంది ఏమనుకుంటారంటే ఎన్జిఓస్ నడిపే వాళ్ళు, సోషల్ వర్క్ చేసిన వాళ్ళు, వీళ్ళందరూ కూడా ఎన్జిఓస్లో 90% ఎన్జిఓస్ అందరూ ఫ్రాడ్ ఎన్జిఓస్. వాళ్ళు డబ్బులు తింటారు, వాళ్ళు సరిగ్గా పని చేయరు, వాళ్ళు ఊరికనే అన్ని ఫొటోస్ షేర్ చేసుకుంటారు, సోషల్ మీడియాస్ అన్నిట్లో ఉంటారని. But the journey of a social worker or the journey of a person who runs an NGO is not at all easy. You have to face so many challenges. You have to face so many things. You have to come across so many things. I'll tell you one experience which I had when I was studying social work. చదువుతూ మాకు ఫీల్డ్ వర్క్ ఉంటుంది. I was working in hospital for mental care. I was supposed to visit a female ward and a family ward. Family ward లో ఒక అమ్మాయి ఉంటుండే, 14 years అమ్మాయి. ఆ అమ్మాయిని పోయి నేను పలకరించి మాట్లాడడానికి ప్రయత్నం చేస్తుంటే, బికాస్ ఆఫ్ హర్ మెంటల్ ఇల్నెస్ షీ వాజ్ నాట్ రెడీ టు టాక్ టు ఎనీబడి. Because I was persisting on her, I was trying to ensure that she talks to me, she comes out of a trauma and respond to me. My first చూసి one day she just looked into my eyes, came close to me and నా మొహం మీద ఊసేసింది. As a social worker, as an individual, you definitely get insulted, you feel very bad, you feel like crying and you that. But there I was a social worker, so the dupatta, I had to just wipe my face like this and keep talking to her, then go back again in my room, and then I cried the whole day. అసలు ఎందుకు తీసుకున్నాను ఈ ప్రొఫెషనల్ ఆ రోజు అనిపించింది. బట్ ఆఫ్టర్ 2 days when that girl started talking, she realized that there's somebody who's ready to listen to me. Then everybody is not against me, everybody is not blaming me, or everybody is not scolding me, and somebody is there to listen to me. And she came out of that, and when she started recovering, I felt, no, the purpose of why I become a social worker, now it is clear. So that is how some of the journeys which it's really helped me to uh, develop this passion and to continue this passion for my lifelong. And women across country, across the world, are having problems, are having different problems. Now, I also had a girl, just 16 years. I met her at a railway platform. She was 7th month pregnant, and she was hitting her stomach to the iron walls. When I told her, why are you doing this? ఎందుకమ్మా ఇట్లా చేస్తున్నావు అంటే, నేనేం తప్పు చేసినా, నాకెందుకు ఈ పనిష్మెంట్? తప్పు చేసినోడు నన్ను వదిలేసి వెళ్ళిపోయిండు. అసలు ఆయనైతే ఎవడు పట్టించుకోవట్లేదు, ఆయనైతే ఎవడేం అనట్లేదు, నన్ను చూసి అందరు నవ్వుతున్నారు, అందరు నన్నే తప్పు పడుతున్నారు, నాకెందుకు ఈ పనిష్మెంట్ అని ఏడ్చింది. ఆ అమ్మాయిని దగ్గర తీసుకొని అమ్మాయితో మాట్లాడి డిస్ట్రిక్ట్ డిపార్ట్మెంట్తో మాట్లాడి డిస్ట్రిక్ట్ హాస్పిటల్లో అమ్మాయికి డెలివరీ ఏర్పాటు చేసి ఫ్రీ డెలివరీ చేస్తే మంచి చక్కటి అమ్మాయి పుట్టింది. బట్ ద ప్రాబ్లమ్ ఇస్, పుట్టిన దగ్గర నుంచి అమ్మాయి నా దగ్గరికి నేను తీసుకొస్తే నేను కింద విసిరేస్తా, నేను గోడకేసి కొట్టేస్తా, నేను చంపేస్తా. దట్ అని పోస్ట్ ట్రామాటిక్ స్ట్రెస్ డిజార్డర్ ఉంటుంది కదా. ఎవ్రీ ఉమెన్ హూ గోస్ త్రూ దిస్ డెలివరీ, దే హ్యావ్ దిస్. అందులో she was saying that. Then I had to control her. And I was hardly I was hardly 20 at that time. I didn't know how to handle things. I was not married. I don't know how to take care of children. But that experience also taught me to become a mother. I became a mother at that time for that baby. 10 days I had to take care of her, because some NGOs who adopt children, they also have a rule that until unless the child is 10 months, 10 days old, 10 days పూర్తయితే కానీ they don't take. I consulted SOS. I wanted to give the child to a better organization so that the child's future is safe. SOS వాళ్ళతో మాట్లాడితే నువ్వు 10 రోజులు కాపాడమ్మా, 10 రోజులు నువ్వు పెంచు, 11 రోజులు మేము వచ్చి తీసుకెళ్తామని వాళ్ళు చెప్పారు. 10 డేస్ హ్యాపీగా అమ్మాయిని ఈ వీళ్ళని పాలు అడిగి, వాళ్ళని పాలు అడిగి, కొంచెం పాలు పట్టండమ్మా, కొంచెం చూడండమ్మా అని. మనకేం తెలుస్తది ఆ టైంలో, అసలు ఏం తెలియదు. అస్సలు ఏం తెలిసేది కాదు. బట్ స్టిల్ బై టాకింగ్ టు పీపుల్, బై కన్విన్సింగ్ పీపుల్, I could feel that girl. And now that girl is a pilot. I feel so proud that, and of course I take it as a pride, because అమ్మాయి ఇప్పుడు అంతగా చదువుకుంది, అంత చేసింది, she's a pilot and she's flying అంటే, God has given me that opportunity to be with the child. So this is some of my experiences that motivates me every day. I do counseling. I run a counseling center. So there are different types of people who come to me for help, for support. They come with so much of anger, so much of frustration, so much of not knowing what to do, leaving everything, despair, ఒక రకమైన అసంతృప్తి, నిస్సహాయత, నిస్పృహ, వీటిలన్నిటితో వచ్చి, when they keep talking and when they go back with a smile on the face, I feel that's enough. The purpose of our life is what that is. So the organization that I run is Magna Carta Foundation. We are at Bharat Nagar, Musapet, Hyderabad. We have a counseling center, we have a reading room, and we work on non-communicable diseases. We work on livelihoods for women and youth, where we work with MSME, we work with financial sectors for linking people to livelihoods. We do skill building, and I'm also internationally trained um, trainer on gender, results-based management, and also POSH Act, Prevention of Sexual Harassment at Workplace Policy. I give trainings on these on gender, on POSH to different corporates, to different organizations and different people. So currently we are focusing on cancer, especially oral cancer, cervical cancer, and breast cancer, because of late what we have seen is people are just dying because the detection of cancer or early diagnosis of cancer is not happening. So we are currently focusing on that. And next month we are covering the whole Mechal Malkajgiri district with cancer screening. With HPV also we are doing, and all tests we are bringing to the person. They don't have to go pillar to post to get their testing done, to get everything done. So we are going to them. And also this year we are trying to saturate Khammam by doing this cancer screening and awareness program. And livelihood is something that I think it's something which breathes along with me. So um, supporting people in taking up livelihoods, giving them support. This is all what we are doing. But as I said, we are a small NGO. We are Magna Kata Foundation is a small NGO. We are registered with the NGO Darpan. We are registered with CSR. We are registered. We have all our documents. But as like any other NGO, we are very small. We are just breeding NGO, and we definitely lack funds. And we are looking for any donors also to support us in funding us for any programs. Lucky enough, our organization has completed 6 years now, and our volunteer base is now 67. I'm very proud to say that my volunteers are also so very committed that any time of the day or night, you just call them and say, this is what we want to do from Magna Carta Foundation. They're all ready to help us out. They're all volunteers because we can't pay them. And we just pay them honorarium as and when we get something, but otherwise, most of the time it is. And by saying that I pay honorarium to my volunteers, I'm actually belittling their work because they do more than what a volunteer should be doing. So We are working out to reach out to people at any time of time. I am really surprised that there are people who just call me to say that Amma మీ organization గురించి తెలిసింది మాకు ఏదైనా హెల్ప్ చేస్తారా. So they come, we try to link up and we try to do as much possible as we can. So this is something about our organization. And I am a professional social worker with my MA PhD in social work. And luckily, I'm married to a person who is also a social worker who has worked on different sectors like um, health, nutrition, HIV, and AIDS. So he has done his excellent work, and now he's working. He has been a consultant for government, state government, and national government, and currently he's doing his job very well. So I think we are a family of social workers who are doing very good job. I'm also blessed with two kids, one boy and a girl. Both are karate black belts and they're international players. So I am happy that I'm able to manage my NGO, my family, my kids. I'm doing this because they are there to support me all the time. I just want to add that you can reach us uh, through our mail ID or our mobile number. We are on Insta, we are on Facebook with Magna Carta Foundation as our name. My mobile number is 90000171158 and our mail ID is magnacatafoundation@outlook.com. So this is how you can reach us to us, and we'll be happy if you'll be reaching us to us either for volunteering or for any other support. Look forward to you all. Thank you very much.